You got a little gate so you can go in and out.
I should have had this procedure a long time ago.
Dick Bonin had a heart procedure at Mercy Hospital St. Louis, which used to be a big deal as it would require a lengthy hospital stay. But for Bonin, his transcatheter aortic valve replacement, or TAVR, was different.
Luckily, I got to go home.
He went in at 6 a.m. for the 90-minute procedure and was home by 6 p.m. Bonin became the first TAVR same-day discharge patient in the St. Louis area.
The procedure basically involves using a stented valve that's mounted on a balloon where we actually insert it into the body, usually the femoral artery, and deliver it to the heart. And it's basically to treat patients with a narrowed aortic valve, which is a very common issue that we see, especially in older individuals.
Now, Bonin's back to the outdoor activities he enjoys, and he feels stronger and healthier.
I was out doing this deck last year, but I couldn't do very much.
Before the procedure, he says having reduced blood flow affected his daily life.
I'd come out and work about 5-10 minutes, and I'd have to go in and take a rest. My wife and I walk, and there's a hill over here. We call it Cardiac Hill. And I had to stop going about halfway up the hill because I was getting a tightness in the chest. And I told the doc about that when he thought he heard something. That's when he said, yeah, you're going in for a stress test. Instead of having about that much blood flow coming out of it, Dr. Zone said I had less than a pencil lead coming out through it. So it was working hard. And, he said I could just kill over any day.
To actually be considered for a same-day discharge TAVR procedure, we did have to go through a checklist of about 20 items, which incorporated his baseline patient characteristics, how well the procedure went, the logistics of where he lived, how his postoperative course went. He met all those points, which allowed him to be discharged on the same day.
Doctors at Mercy Hospital St. Louis were the first in the area to do the TAVR procedure in 2012 after it was FDA approved. It started with hospital stays as long as 10 days. Alongside advancements in medicine and technology, the typical stay shortened to a range of 30 to 34 hours. Then Mercy says because of the pandemic, Mercy Hospital St. Louis tried something new. That's when patients were sent home on the same day, and doctors discovered they did well.
So because of COVID, it kind of initiated this approach. We really felt like this was something that was good for our patients, and it also freed up resources for other patients.
Bonin says he didn't realize how badly he needed the procedure until he had it done.
I didn't think I was sick. I didn't think I had a problem until, especially after the procedure. So I'm lifting these boards right now and replacing this deck, but I feel 100% better, sleeping better. I feel like I've gained an extra 10 years.